Good morning, everyone. Thank you for joining us for this special surgery and anesthesia virtual Q&A for high school students. My name is Scott Evans. I am the Community Engagement Manager at Wesley Medical Center in Wichita. Thank you very much for joining us today. I'm joined by three fantastic nurses who are involved heavily in the surgery program here at Wesley Medical Center. Joined by Lisa Betosh. She is the clinical educator over surgical services. Tanya Gibson is the OR manager. And then Megan Cook is a nurse anesthetist. She's the CRNA and the program director at Newman University for the nurse anesthesia program. They're going to talk with you this morning about surgical services, surgery, and answer the questions that you submitted. I am wearing what looks like a factory outfit. I mean, this is PPE. Since I'm in normal clothes, I don't have scrubs. I have to wear this, and you guys can probably talk about that as we go this morning. But I'm going to step off, let them answer your questions, and give you a little bit more detail about their background. So, Lisa, let's go ahead and start with you.
My name is Lisa. I've been an OR nurse or in different positions in the OR for almost 40 years. I love what I'm doing right now as a clinical educator. I get to work with all the nurses in the scrub techs and pre-op, PACU, OR, endo, and sterile processing.
I'm Tanya Gibson. I have been in the OR for over 20 years and here at Wesley for a little over 2.
I'm Megan Cook. I'm a CRNA, a certified registered nurse anesthetist. I was a nurse here at Wesley and the SICU, and then went to nurse anesthesia school. And now I am the director of the nurse anesthesia program, but I also practice anesthesia here at Wesley.
One thing people talk about is what do we wear in the OR? We get to wear scrubs, which is fantastic. They are provided by the hospital, and we don't have to launder them, take them home. We come to work, we change, and we get to wear nice, comfortable clothes.
One of the things about the clothes that's special to the OR is once you go past the red line, you must have on very specific surgical attire. The OR is a kind of a unique environment where the temperature, humidity in your rooms are all on a very specific guideline.
So there were a few anesthesia questions, and one of them was, how long does it take for us to put the patient to sleep? Well, it doesn't take very long. Sometimes patients will try to count backwards because that was kind of the old school way of going to sleep with anesthesia, but the medications that we use now are really fast acting, and so if somebody tries to count backwards from 100, they usually never make it to 90. So it's pretty quick.
That's awesome. And one of the questions was, what are the career growth opportunities? If you are a nurse, you can go from being a circulator in the OR, and if you can get your certification, and then we have programs where you can learn to be an educator or the manager or even the director of the surgical services. It just depends on what you want to do. We also have opportunities where you can be an RNFA, where you can actually be up there assisting the physicians and surgeons while they're doing the procedures. So there's lots of growth opportunities.
One of the questions was, are there any entry-level job opportunities in the OR? Yes, there are. So there are OR assistants, which is an entry level, which is a great introduction to the OR where you come in and you assist in the OR anywhere from helping turn over OR rooms to interacting with patients and getting them and bringing them to the unit. It's a great introduction to is the OR a place where you would like to work?
And I was just going to piggyback off of some things that Lisa said as far as education. To become a CRNA, I do have to go to nursing school first, like we all did. So go to nursing school and obtain a bachelor's degree, and then it is required to work in critical care nursing to get some background there. That's why I worked in SICU here at Wesley. And then you can apply to go to nurse anesthesia school. Right now, that is a 3-year program after getting your work experience. And then during that time of the program, you're in the operating room, you're doing and providing anesthesia, working in conjunction with other CRNAs and physician anesthesiologists.
Megan, what's the difference between a nurse anesthetist and an anesthesiologist? What can they do that you can't, and anything you can do that they can't?
So the scope of practice and the job description for a physician anesthesiologist and a CRNA is roughly the same, but it depends on where someone practices, how that looks. There are anesthesia care teams, which is what we have here at Wesley, where physician anesthesiologists and CRNAs work together as a team to provide care for patients under anesthesia. And there are different types of practice as well, where physician anesthesiologists may practice in a group alone, or CRNAs may practice in a group alone, and that's just dependent on where that might be. But here at Wesley, we're an anesthesia care team.
And the difference in schooling?
An anesthesiologist goes to medical school for 4 years and then applies for a residency program and undergoes a 4-year, 1-year internship and 3-year anesthesiology residency. And a nurse anesthetist or CRNA obtains a 4-year bachelor's degree, then generally speaking obtains about 2 years worth of experience in an ICU setting, and then another 3 years for nurse anesthesia entry-level degree, which right now is a doctor of nurse anesthesia practice. So it is a doctoral level, like all advanced practice nursing is at this point.
One of the questions talks about who do we get to work with. In the OR, we have what Connie's already talked about, the ORAs. They help us with turning over the rooms. We have scrub techs. They're the ones that are scrubbed in, setting up the back table, handing the instruments and the required equipment to the surgeon. We get the anesthesia providers. We have the surgeons. And then we also have students. We have scrub tech students. We have nursing students, medical students. We have residents. We have CRNAs, or going to school to be CRNA students. So we get to work and interact with lots of people. We have radiology. And the list can just go on and on with all the different teams that we're able to work with.
One of the questions was, what do you love about your job or this position? And that what Lisa was talking about is one of the things that I love is that you get to work with a group of crazy smart people from many different avenues, from the doctors to the nurses to all the different staff that come in to see us, and you guys all work together as a team to take care of patient, because obviously patient focus is the #1 thing that's for us. The other thing that I love about the OR is technology and how much things continually change through the years, that you're always learning, and your brain never goes stale when you work in the OR.
Your hours are different than other nurses who work on the floors, correct?
A little bit, yes. Here at Wesley, we're a level 1 trauma center, so we are open 24 hours a day. Generally speaking, first shift comes very early. You can come anywhere from 5:30 in the morning if you're coming in, let's say the heart team, to 6:30 in the morning. So you can work during the day, you can work in the evening, and you can work at night. And kind of the same thing goes for anesthesia. They kind of follow the same hours as the OR nurses.
Are they still 12-hour shifts?
They could be a combination of 8, 10, or 12-hour shifts, or anywhere in between, whatever is needed.
Same for us in anesthesia.
One of the questions is how fast-paced is your position? That's the one thing in the OR. You have to be very fast-paced. You have to think very quickly. So if you like a job where you are not just sitting looking at a computer screen, and you have to critically think and be multitasking at all times with many different people.
A lot of the nurse positions that we've talked about and done before, a lot of the questions have asked, how do you develop relationships with your patients? what is that like and dealing with family members? As an OR nurse or CRNA, do you deal with patients? Do you work with patients a lot, or is it just your hospital colleagues, since patients are usually out? How does that dynamic work?
Anesthesia, we do meet every patient. We go and do an extensive health history and physical. I also work in the OB unit, so my patients are awake when I'm taking care of them, and undergo, in the middle of a very, very happy day. And so we meet each patient, we talk to them and answer any questions they might have about the anesthesia choice, whether it's being all the way asleep for a surgical procedure or it's an epidural to take away the pain of childbirth. And so we are able to establish, a nice relationship with our patients, which is really important from our standpoint, because we want to have our patients trust in us, because we are caring for our patients during they're very vulnerable during anesthesia and surgery. And so we're asked to be able to meet with each patient individually, and nursing does the same as well, meets with each patient. And so it's our job as the OR team to gain our patients' trust and establish a relationship with them, even though that a lot of times is over a very short period of time.
I have to say that yes, for an OR nurse, when same as anesthesia, when you go to the pre-op area, you meet the patient, you might meet their family or significant others, and it's amazing how quickly you can establish some trust. And with that patient, you can hold their hand when they're going to sleep. And that patient just knows that you're going to be there for them, that your number one job is to take care of them while they are asleep, and when they wake up, that your team will be right there for you. And it's just an honor to be able to do that.
How many patients do you typically see in a day as an OR nurse?
That can range from just one patient. If you have a case that can last 8 hours, you have a complex spine case, maybe a complex heart patient, it could take your whole shift. But then you can do some quick cases where they can last maybe an hour. So you can go through 5 or 6 in a day.
And usually you're not caring for the same patient for days outside of OB, a couple of days, but usually it's a brief interaction before and maybe after, and then most of the time you don't see them again.
That's correct. We hand them off the PACU, post-anesthesia care unit, which is nice that we only have one patient at a time that we're caring for. We don't have a whole unit of multiple patients. So we have one patient, and that's our focus.
One of the amazing things I think they're talking about the short interaction is, even though we might only see that patient for a little bit, you would be amazed at how many thank you notes that everybody gets in the OR team for taking great care of me, taking great care of my family member. And it's amazing, and just makes you feel like you're doing a great job.
I think there's a lot of fear for patients coming into surgery. They may not know how the surgery is going to turn out, or they may, be afraid of anesthesia. And so, as she said, just being able to form that relationship and forming a bond with them is I think unique to us in this position, that we are able to do that very quickly and establish trust with our patients, that we can, put them under anesthesia, provide them with a safe anesthetic and surgical procedure, and then wake them up at the end and get them on the road to healing.
One of the students at West High, Melanie, asked, what was your motivation through the toughest times of your schooling? And I'll even add rotations, clinicals, residency stuff as well.
I think for me, during nursing anesthesia school, the hours are incredibly long, but I have never once regretted my decision to pursue nurse anesthesia. I love doing anesthesia. I graduated in 2007, so I've been doing anesthesia for a long time at this point, and I still, every day that I get to come to the OR to provide anesthesia or to labor and delivery, I still love it as much as I did the very first day. When a patient wakes up at the end of the case and feels good and doesn't have any nausea, or they're not throwing up, and They feel good, I feel good too, and I don't get tired of that. So that was my motivation, is that I truly loved what I was doing. And so I think if you love what you're doing, you can persevere through the hard training that it takes to get there.
Completely agree with that. It's just going to your clinicals and taking care of those patients, which I think is why we do this job in the first place. That motivates you to just study hard and get through it. And
Exactly.
Should we show the video of the OR? Do you want to talk about that? Does that work?
sure.
One of the questions talked about how do we end up learning all of this, the tools and the equipment that are in the OR. And so we're going to show you some of those equipments and some of the tools. But some of it is by preceptors, where a nurse teaches the new nurses. It could be by vendors. They come in and they give us in-services. So lots of different ways that we're able to utilize all these tools and equipment that we use.
I know one of the questions people always ask is how do people learn all of the tools and equipment and instruments? And I always have to laugh and say, I name all of my stuff to food. I learned all of my instruments.
This is showing one of the supply rooms that we have. There's the instruments are over behind her with in the instrument metal containers. This is mesh, and there's different sizes of mesh that we have, different products that we use. One of our stapler cards that we use to put things back together, to be abdominally or skin. We have lots and lots of different types of suture that the surgeons use in different surgeries.
Getting ready for a surgery case is kind of like going grocery shopping, because there are different sections of supplies, and you have a list, like a grocery list of all the things that you might need for that surgery. And so this is showing you all the supplies that are available that you pull to get ready for a surgery for the day.
Those are some emergency anesthesia carts there. So we have different, we have lots of things in place that if we needed to, this is an emergency intubation cart. So it has everything that we would need as far as anesthesia to safely secure someone's airway with a breathing tube. It has just different types of airways in that drawer. That's all of our medical gases there. Those are oxygen tanks that we might use to transport patients on oxygen from the operating room to the recovery room.
Some of the tanks are CO2 that would be used for equipment. Some specific cases would be laparoscopic cases. Got to have clean hands in the OR, so that's the scrub and the hand cleaner for your hands to start out the day or before a case. Always got to protect yourself and to take great care of your patients, so always wear eye protection when you're scrubbed in a surgery.
There's a lot of equipment in the OR, so go into taking care of one individual patient. IV poles, suction equipment. The OR table is unique because it can go in many different positions to accommodate for the surgery itself. The mattresses are made of a special material that helps prevent pressure on various parts of the body.
And that's one kind of cool thing about we're talking about. There's so many different people working in the OR in such a small space, but everybody knows what their job is and what to do. And so everybody just moves around very easily amongst themselves.
That's the heart-lung bypass machine or the cardiopulmonary bypass machine. So if you have to have a procedure that involves the heart, either having blood vessels if you've had a heart attack, or if you have some vessels that have some blockages, or sometimes we replace the valves inside your heart. And if so, this is the machine that your body would be connected to keep you getting the oxygen that you need and remove the waste. That's an emergency cart for anything that we might need during surgery.
That's our Da Vinci robotic machine for our robotic surgeries. We actually have 4 of them here at Wesley. A lot of people, I think, when they're training on the robot, it's sort of like a video game because you are using graspers and all kinds of little things to be able to do your surgery. Those are the arms of the robot.
And the benefit of the robot is it allows for different ways of moving the instruments and being able to access different parts of the body that you wouldn't be able to in the normal way that we have done surgery prior to using robots. The instruments can move different ways, and so there's more, the surgeons are able to be really precise with their movements of the instrument.
And you have very small incisions compared to making a very big open incision.
Which makes recovery better for the patient.
That is the O-arm used for many different types of orthopedic or spine cases.
The big X-ray machine that goes all the way around.
What type of cases would you use the robotic device for?
Hysterectomies is one of the most popular ones that we do. We've been using it more on taking out people's gallbladders. And then also bowel resections, taking out part of the colon. They can use the robot arms in there.
Hernia, many different, taking out part of a kidney. There's, yes, many different avenues.
We even have a robot to help with orthopedics. So they use it for total joints to make those precise cuts of the bone so the implants fit perfectly. So robots is still coming into the field of the surgery more and more.
Any idea what the most common type of surgery we perform here would be? Or the most common surgery you're involved in? Or is it just so different that?
I do such a variety.
There's such a huge variety. Since we are a trauma center, we do get lots of orthopedic cases, broken bones, spines, craniotomies, where we're going to have to fix your head. But we do general cases. Yes, there's so many different.
So let's go to the opposite end. Nicole wants to know, what is the most unusual type of surgery you've been involved in?
Oh, goodness.
That's a hard question.
That is a hard.
Every surgery is different. Even if it's a routine case and you've done a whole bunch of gallbladder removal, every case can be unique and different. And I think that's why we all love it so much, is that it's never boring. It's even if you're doing the same case back to back, it is never boring because
Every patient is different.
Exactly. Every patient's different. Every patient's anatomy, what they look like inside, is slightly different. And so every case, even if it's the same one, it still provides a unique opportunity for us to care for the patient.
And grow and learn.
How has COVID impacted what you do?
So surgery-wise, or how we take care of patients or performing surgery, has not changed. We do have more safety guidelines, especially from an anesthesia standpoint and intubating patients.
Especially in the early days of the pandemic, when we had a lot of unknowns, and so there were a lot of extra precautions that we took. In some instances, there were a certain team. There were just a few people that were, moving from different ORs to do the intubations and secure the breathing tubes. And now we've kind of migrated into, we're not running low on our protective equipment anymore. So we're able to, we each individually care for our patients. So there's not somebody having to move from OR to OR to provide that. And that was in the very early days.
So we just follow a very specific protocol for COVID patients. That is just now our routine in surgery. It's just an add-on procedure, basically.
I want to jump back to the entry-level position, the OR assistant. In addition to basic life support training, a high school diploma, and 18 years old, what other qualifications are you looking for in hiring that position? And then where can you go from there?
Enthusiasm, a hard work ethic, just wanting to be around people and wanting to learn. Once you are an ORA, here's a good example. We have someone right now, we've had some ORAs who have become nurses. We have ORAs that have become scrub techs after being here. We have ORAs that have gone on to medical school. So it's just a great introduction to what is the OR or environment alike, because it's not for everybody. So it's such a great introduction.
What does that orientation look like for an ORA?
It's like a 2 weeks orientation where you're working with one of the ORAs and meet with me, and then just have to learn how to clean a room. What's the process? And we have very specific guidelines of how to clean an operating room. Where the location of places are in the hospital, going to where do I find a report tower. So just navigating the hospital itself, navigating the OR, it's a huge department. And doesn't take long.
No, and that's when you get introduced to so many different things. People might not know anything about anesthesia or what they do, and it's a great introduction to anesthesia. Maybe you want to be a nurse, anesthetist after you are an ORA.
Anything else you guys want to talk about? I know we've covered a lot.
I was just gonna say, you've seen some of the other equipment. There's an anesthesia machine back here. I don't know how well you can see it, but this is a big machine that allows me as a CRNA to do everything I need to do to keep the patient safe and sleep during an anesthetic and a surgical procedure. So it's a lot of going on. So in nurse anesthesia training, in labs, we have 2 different anesthesia machines. And so students will go through the process of learning all of the equipment that is inside and outside the anesthesia machine, from the breathing circuit that we are able to give oxygen and anesthesia gas to the patients. And also we breathe out carbon dioxide, right? So we have to have a way to get rid of the carbon dioxide when we have this closed system. So there's a way that we can do that on this machine. We absorb carbon dioxide here. This bag allows me to breathe for the patient if I need to. There's also a ventilator that we can turn a switch on so that the patient they're not always breathing on their own, so we breathe for them. This monitor, though it's not turned on, tells me heart rate, heart rhythm, blood pressure, how much anesthesia gas the patient's breathing in and breathing out, how much carbon dioxide they're breathing out, and any temperature. There are lots of different things that we can follow on this monitor here. And then there's lots of different controls here on the anesthesia machine. We can use different types of gases to give anesthesia to the patient. And so we have a couple of different types of anesthesia gases to choose from. Nitrous oxide, which some people know as laughing gas, or you may have had that at the dentist. We use that sometimes in anesthesia as well. So it's just a complex system and machine that keeps patients safe while under anesthesia.
All right.
I do have one thing to say is that an opportunity like the high school students interacting with the healthcare system in high school that wasn't available for me, and I think it's a great opportunity if you even think that you might be interested in a health care career to take the opportunity to expose yourself to new jobs and learning.
I want to thank these lovely ladies for graciously giving of their time. Lisa is the OR educator, and we've got Tanya, who's the OR manager, and Megan, who is an awesome CRNA. So yes, we have some opportunities for you. We are looking at some sort of career launch again coming up, at least this late summer, midsummer, maybe end of May. We're figuring out what the actual dates will be. And some of those students that come and part of that have been in the OR for a couple of hours. Some even got to watch a heart surgery. And this is a heart room, as I understand. So someone might have been in this very room watching somebody's heart being repaired. So think about that. And as you are watching this, and at the conclusion, you will have an evaluation given to you by your teacher. And we really, really want you to take some time to give some thought to that and return it to us, because we look at all of those comments, and that gives us some ideas of where we need to go next month or for the next opportunities of these question and answer sessions. So please take the time to do that. And again, ladies, thank you so much for having me.
Remind us